A randomized trial of Hyperimmune Globulin to prevent congenital Cytomegalovirus. Background: congenital infection with human Cytomegalovirus is a major cause of morbidity and mortality in a controlled study published in 2005. Administration of cytomegalovirus-specific Hyperimmune Globulin to pregnant women with primary cytomegalovirus infection significantly reduced the rates of intrauterine transmission from 14% to 16%. Report.
In terms of another virus that sometimes brings a lot of questions as to testing, there is one virus called Cytomegalovirus. And Cytomegalovirus gets its name for what it does to the cells. It actually, under the microscope, makes the cells like giant cells or something. They look very big. And so the name Cytomegalovirus. In a simple manner for the lay person, I think it's the model that we all know about. Chickenpox and measles and German measles, and childhood illnesses, is a good example of how most things respond with cytomegalovirus. First of all, the vast majority of the population has been exposed and has had cytomegalovirus. It often will happen in childhood or adolescence, teenage years, early adulthood. It will be exposed through some kind of intimate contact, whether it's a sneeze or a kiss or something else. Sexual activity possibly can do it. It shows itself as an influenza-like syndrome. Fever, you don't feel well, you're not hungry, you're nauseous, you're vomiting, you don't want to get out of bed, you want to sleep, you're dizzy. It looks like a flu. And for the vast majority of people, they will have, quote, a bad flu with maybe 102 fever. For an adult, you know, that's a lot of fever. And it will pass, and that will be the end of it. And they'll think that they just had maybe some kind of a flu, the seasonal flu or something, and in fact what they had was a CMV. When a mother who is pregnant gets CMV, it is a different circumstance. And it crosses the placenta. It infects the fetus. The fetus has an immature immune system. And so in the fetus it can cause much more severe infection. It can cause encephalitis. It can cause hepatitis. It can cause blindness, deafness, similar as German measles can, rubella can. It can even cause death of the fetus. It can cause the fetus to go on to have a chronic shedding condition where they will shed virus for years and years. Mental retardation. It's a bad disease to get during pregnancy.
Methods. We evaluate the specificities of Hyperimmune Globulin in a phase 2 randomized placebo-controlled double-blind study. A total of 125 pregnant women with primary cytomegalovirus infections. 5 to 26 weeks of gesters were randomized as seen within 6 weeks after the person's onset of infection. They receive Hyperimmune Globulin or placebo every 4 weeks until 36 weeks of gestation or until the infection of cytomegalovirus in amniotic fluid transmitted.
CMV is usually passed from infected people to others with such as urine, saliva, vaginal secretions, and semen. Although getting CMV through casual contact is very rare, CMV is sexually transmitted. It can also be contracted through blood transfusions and transplant of organs. CMV can be transmitted from pregnant woman to her fetus during pregnancy. Some babies do develop health problems that show up either in infancy or later in childhood. Most individuals have a mild flu-like episode upon initial infection. Permanent health problems or disabilities due to congenital CMV include the following: hearing loss, vision loss, mental disability, small head size, lack of coordination, seizures, and death in some rare cases. Healthy people who are infected with CMV but show no symptoms usually do not require any medical treatment. There is no licensed treatment for pregnant women who contract CMV during pregnancy. Scientists are working on CMV vaccines and looking for other ways to prevent congenital CMV during pregnancy. Prevention of CMV for the normal, healthy person includes good hand washing techniques and using a condom when sexually active with a partner that you're unsure about.
Results. The rate of congenital infection was 30%. In the Hyperimmune globulin group and 44%. In the placebo group, there was no significant difference between the two groups or within each group, between two women who transmitted the virus and those who died not, with respect to levels of virus-specific antibiotics. This also indicate immune responses or viral DNA in the blood. Ventricular.
Hello and welcome back to MRCPCS team. Today's topic is congenital Cytomegalovirus infection. Especially, this is very important topic for MRCPCH examination, especially for MRCPCH part 1 that includes A. So you need to memorize these findings and you need to diagnose and you need to differentiate it from other congenital infection syndromes. Okay. Let me start with this without wasting much time. Before starting, I would request once again to subscribe to my channel and please do not forget to tell your friends about my channel. If you like it, thumb up. Okay, the risk of intrauterine transmission is highest when primary infection occurs during the pregnancy. Remember, whenever there is an infection in the first half of the pregnancy, because at that stage there is a development of the organs of the fetus. That's why whenever there is an infection at that stage, whenever there is a anything that takes place if she is taking a drugs unknowingly and she doesn't know that she is pregnant and she is on the first trimester of the pregnancy, the congenital organism will be affected more, because at that stage the organs will be forming, right? That's right. Okay guys, this is what you need to memorize. Among the congenital infected infants, approximately 10% signs of symptoms are present at birth. These symptomatic infants have been reported to have 40 to 90% risk of subsequent neurological sequelae, including mental retardation, microcephaly, developmental delay, seizures, disorders, and cerebral palsy. This is very important. Although the remaining 90% of infants are asymptomatic at birth, a range of 7 to 20% have been reported to subsequent develop permanent sequelae, particularly sensory hearing loss. Hence, congenital infection will be classified as symptomatic or asymptomatic in nature. Okay, there is no image to see below. I think my mistake. Overall, it has been estimated that in a given cohort of 1,000 infants with a congenital infection. So I need to remember this. Forget about that. Okay, the important what I want to tell you before this is the CMV virus is a DNA virus, right? It belongs to the family of herpes virus. And then especially what you can symptoms in the neonates, especially you need to memorize is because of microcephaly, intracranial calcifications, choroidoretinitis, osteitis, and anemia, thrombocytopenia, hepatosplenomegaly, prematurity, and UGR. Same thing what you see in the rubella. That's it. The
Conclusion. In this study involving 123 women who could be evaluated, treatment with Hyperimmune globulin did not significantly modify the course of primary Cytomegalovirus infections during the pregnancy. Thank you.